All right, good morning. Good day, everyone. And we are on Facebook Live. And this is Westchester Gov, Facebook Live, and our continuing discussions as we're starting to unpause in New York. And that was a great smile that we see from the Chief Medical Officer of WMC Health, Dr. Renee Garrick. Thank you so much for being back with us. You and I did this a few weeks ago, and this is part of the challenge, things changing so quickly that someone might say, hey, wait, what new things could happen? You're gonna tell us about the new things that are happening. So first, Dr. Garrick, let me say good morning to you. And again, hope everything's going well for you and your family over there at WMC Health.
To be back, and you're right, it feels like it was a few weeks, but it feels like it was a year ago because this has been such a rapidly changing, fluid environment. You know, we talked last time, we were still thick in the throes of COVID and the COVID pandemic, and now we're starting to be part of the recovery, and it's great to be part of the recovery. You know, the county's beginning to open up under very careful guidance, and it's what we need to do. A lot of masking, a lot of social distancing, and that's the way to keep on top of this. But you know, the last time we spoke, we were still talking about having hundreds of patients in the hospital. Now we're down to under 15 patients in the ICUs with COVID. Wow. Yeah, it's you know, you can really feel the difference. Obviously, one of the important messages to the community is to make sure that people who have not sought care, who are at home, understand that it's absolutely safe. The hospitals are safe. We test every patient who comes to the hospital for an admission every day, and anybody who has COVID is cohorted. And you know, that's a really critical message now, because as we all saw in the press, there was a huge drop off in the number of patients who sought care. You know, I know heart disease didn't disappear in this country. Unfortunately, cancer didn't go away. And there's a lot of need for people to get back and to understand that the hospital is open, safe, and part of the recovery, and want people to be able to come back and get care. All the specialists are here. Elective surgeries are now going on thanks to the governor and to you know, seek care and make sure they get it.
Yeah, and that's so critically important, Dr. Garrick, because when we talked last time, as you said, you already had protocols and extensive protocols as all of our health institutions did, but certainly at WMC Health, you all had the screening that took place outside the emergency room. You did all of the protocol screenings, and as you said, cohorted. I'm going to use the non-medical term, which was just making sure that we put people together that were potentially COVID positive, because it was potential. You didn't have a fast enough test. Even if you had I'm not sure you all use that Abbott 15-minute thing.
So that's a great question. That's been fascinating. You know, we have stuck to the full test, the full nasal swab, because that has the best predictive value. And, you know, some of the tests that were really rapid turned out to be not that accurate. So we, you know, true to the science and doing the full nasal swab and running that. So we actually do what the fancy word is a PCR, but what it really means is look for the virus itself. And we're testing every patient, and we're actually very proud of that. We're one of the probably few places that has ramped up to do that. We actually can do that now with the same machinery on site. So we've actually brought it into the hospital. So the same thing we were doing with the tent for those, like almost 40,000 PCRs were done through our drive-thru. Wow. We now have that same technology right in the hospital itself, right in the hospital proper. So we continue to test all the patients. And certainly if you're coming for elective surgery, we want people to understand anyone who's coming in for an elective procedure gets tested. And we make sure that within 3 days, we know if you could possibly have been exposed to COVID. So this ongoing testing for the actual virus, the so-called PCR testing, remains critically important and is very much a part of our day-to-day work. Both to be sure that if you're an inpatient, we can have you in a separate part of the hospital, cohorted and safe, but also if you need an outpatient procedure or an elective surgery, we want to treat you carefully and do the same thing. And of course, in the hospital, it's actually very cool now. We have scanners that you actually walk by. So, you know, in the old days, we had to, you know, do the forehead scanners, et cetera.
Yeah.
Now we have telescanners, and soon we'll be able to do an MRI just walking by.
I saw that in some movie. I think it was Total Recall, right? Some Schwarzenegger movie.
Walk by and it gives you a little light that tells you you don't have a temperature. It's very cool.
So that is awesome. But again, again, we can't echo enough, as you said previously when we were talking and we started out today. The hospitals are safe, and if you were before March, you thought you needed to go to the hospital, you should go, right? And you have all those procedures in place. I know in Yonkers, where I live, we would have had our Relay for Life this past weekend, where we do the relay scenarios, and that obviously for American Cancer Society, is that we would have done that. And we know, as you said, people still need their treatments. People still needed to make sure to get themselves checked out with heart disease. They need to make sure that if they had any breathing scenarios that were happening with their COPD or their asthma, et cetera, if you need to be at the hospital, go, right? And you have all the procedures in place to do that.
So for example, when you go into the hospital, right there waiting for you is hand sanitizer, masks if you need it. And that is a big part of the need here. And I think the folks from the CDC and the Fauci and his colleagues have tried, Dr. Fauci, have tried very hard to explain to people that a mask is a medical device. Wearing a mask prevents you from getting someone else sick. There can be nothing more important than that in terms of good citizenship. And doing that, if we all had on a mask and kept social distance, we would all be able to recover faster, and we'd all be able to beat this virus more quickly. And we will be able in this country and in this world, we will figure out the best treatment, and at some point a vaccine, and we will get ahead of this virus. And in the meantime, we have to be smart and safe and do the right thing. And the county and the state have been great partners in helping to have that happen. We've worked, as you know, really closely with the Department of Health for the county and with Sherlita and her colleagues. And that's what it takes. It takes a whole team in one direction. We've gotten through a big hump here, and now we're part of the recovery, and it feels good to be in this position. You mentioned before about the antibody testing, which has become, I think we've done almost 15,000 antibody tests.
Wow. All right.
We're doing those over in the county center. That's the real antibody test. We actually draw a tube of blood. And I'll tell you what we've learned from that. It's been fascinating.
What do we learn?
We have learned that the antibody positivity of the hospital workers here is below the antibody positivity of the general public. And you would say, whoa, you would think that with a lot of exposure in a hospital, it may not be that way. What that proves is that good personal protective equipment, masks and gloves and gowns and careful infection control procedures work. Because here we are, an exposed staff, and our positivity rate is less than the general public, despite obviously higher exposure. So it just proves the point that, good personal protection works. And, we're proud that we did that, and we continue to do it now for our patients as they're coming back into the hospital. So
that's fantastic, Dr. Garrick, because again, got my mask right here, right? So obviously I don't wear it. Again, you're at home in your office. I'm at home in my office. And I tell folks all the time, I'm like, when you're at home, you don't wear a mask when you're at home. However, when you're interacting with someone who has not been in your home, right? People that are visiting, they have masks on, you have staff come in, and when you go out into the public areas, I'm confident as you do having your mask on, just like we would have here. And that made a difference in the way we were able to do that. But that was fantastic information, because again, when we had our last conversation, WMC Health was just starting up the antibody testing, and it was targeted to first responders, certainly nurses, et cetera. And now it's opened up to everyone, right? And they need to do that. We're going to give that number out a couple of times for people that are interested. They think that they would like the antibody testing. They call a number. You need an appointment. You can't just roll up to the county center, because we'll just roll you out, right? And not be able to get in. You definitely need an appointment. The antibody testing is extremely important. But the point you raised about people making sure to wear mask or face coverings, right? When you can do just as simple as face covering, social distance, and you yourself can help make a difference to make sure that we're trying to control, because that's what we could do. We're not stopping the spread of the virus. We're definitely controlling it and trying to manage that, and you're not infecting someone else.
And Westchester County has done a terrific job. I'll tell you that when you go out, if you go to a store, you go to the dry cleaners, people are wearing masks. People are socially distancing. People are being very respectful, and it's because you've done a really good job messaging this to the county. You drive down the Sawmill now, and it says wear a mask in public. And
Yep.
it's really excellent public health work on your part, because it lets the public know this is important. We're all doing it, and it makes a difference. And you're right, when you're in your own home, when we're in our offices privately, there's no one else here with me, it's completely safe. But if I go out, I put on my mask. And it's that simple, and we're going to keep doing that until we get all the way through our recovery, and we get on the other side of this virus, and we will. So I wanted to mention to you, you brought it up last time, and we didn't have yet all the information about the use of telehealth.
Yeah.
And so, in the beginning, when the hospitals were really closing the practices to a lot of outside entry, we put into place a telehealth system so that we could do exactly what we're doing right now. I can Zoom with patients. They can show me their blood pressure machine. They can take their blood pressure, and I can see the readings and make sure they're doing it right. We can go over their meds. They can show me their bottles. I can show them their lab results. And we've done almost 15,000 visits now by telehealth, just in our practice. And it's been an extraordinary experience. And we actually want to keep some of this going after COVID, because imagine how much easier it would be during winter months, or when someone's ill at home and they can't easily get to a doctor, to be able to have this kind of conversation where you can see things very clearly and help people. So that has been a little lemonade in all these COVID lemons, has been this ability to expand telehealth platforms. And it's been an absolute game changer. And it's
well, you have something.
The patients.
Dr. Garrick, one of the things you were saying, and again, the telehealth opportunities, because it had more, as you said, it's the lemonade out of the lemons that we had. And we've seen, do we need everybody necessarily in the office that we have, right? That they can they work remotely and do that. And a lot of places, people found out, hey, you can have remote. Yet we all want to have human contact. That's just, we're that kind of individuals. As I would tell all the people, I'm a hugger. So this is a bad time for me. But at the end of the day, being able to do these things differently. Talk a little bit more about telehealth, because I think that the challenge that we have seen, and you can tell how to address it. The people that were already used to and had doctors and they had physicians, it works out. The telehealth medicine worked out a lot better for those individuals that had regular practices versus somebody like the first time that they're getting engaged in the health system. So talk to us about that and what WMC Health specifically is doing for those new, never ever first timer telehealth folks, and how does that work?
And so I'll tell you what happened. When we started testing in the tent, we realized that some of these individuals didn't have physicians. Now imagine you get back a COVID test and it's positive. You don't want to run to an ER, because that's the last place you wanted to be, and you didn't really have a doctor that you were hooked up with. So we called every patient. So it's 38,000 phone calls, and said to them, here's your test result. And if they were positive, we volunteered to help them and said, if you need medical help, if you need a doctor, please feel free to let us help you. And then had the first phone call, and then learned with people, especially because a lot of patients have an iPhone. And one of the things that you folks did was to make it possible to not have it be a law that I couldn't use someone's own personal iPhone to communicate with them. And we taught them how to download a little app and go on their iPhone and talk just like we're talking. And then people could see each other. And once they were able to do that, they felt more comfortable. And now we're having patients come in for visits. So all in all, we sent about 250,000 communications out to patients, in addition to the 40,000 that were done in the PCRs. So we sent about 250,000 different types of communication to our patients. And now with the beginning of the recovery, we've sent about another 100,000 out to just remind people, if you need care, we're here. Don't be shy, call your doc, come in for a visit. And if you can't get in, we have new platforms and new systems to be able to help you. So it's been a great opportunity, and you're right, for many of the patients who drove through the tent were terrified because they got back these results and they didn't have a place to turn. And we tried to make sure they felt comfortable, make sure they knew how to get access to care, which is a big part of what we need to do with all of this, care. You've seen that there's some disparities here about how COVID is affecting different populations. We really need to focus on that. We need to make sure that everybody has access to care and that we're treating this in a very organized, thoughtful way, because we all learned that there's some areas where there are great disparities about how COVID's impacting different populations.
Well, and that's actually, and that's again, taking the lemons and learning how to make lemonade, and more importantly, learning the lessons that we've learned through this particular process to be able to make difference and positive and impactful change in the communities as you talked about it. So one, if you were needing elective surgery, that's been opened back up. Did that start? That started this week again? Right?
Yes. So we have our waiver, and we've started our elective surgeries. We are still making sure that they are truly needed surgeries, because there are some surgeries that are super elective that could wait a week or so, and then there are the elective surgeries that really need to start coming back. And we're booking, and we're about at 60% now in terms of our capacity. We have lots more capacity and lots more patients who need care. We typically, on a holiday weekend, we would have had 70 or so transfers in. We're at about 60-ish% of that, and as the weather gets a little better and people are a little more active, we expect that will come back up, because we are hopeful that people will feel a little more safe and a little more willing to take good care of themselves and say, okay, I can now keep that doctor's appointment. Now I'm okay and I need to follow up. I was going to mention too that in terms of access to care, one of the things that really was obvious in this COVID pandemic is mental health.
Yeah.
It's a real toll on people. People were out of work. Suddenly they were schooling their children at home, not sure how this was going to go, worried about their loved ones, hearing things every day about increases in the death rate, etc. So early on, we ramped up our mental health services, and as you know, we are the largest provider of mental health in this region, other than the state of New York is us. We have over 300 beds, and we started a 24/7 mental health hotline, so that anyone can call, anybody who thinks they need help, because we want to be there. We want to be able to help people. That's what we do. And I really want to applaud our mental health team, because they created an entire free platform for anyone who needs it, to make sure that we're also taking care of mental health needs as well as physical health needs, because they go hand in hand. If you're depressed, you don't do well. You don't take your pills, you're not taking good care of yourself. So depression and anxiety are critical, and they need to be confronted, and we need to help take care of people.
So Dr. Garrick, because you mentioned about that service, which is outstanding. It's free. It's something WMC Health is providing, and again with the app, certainly there's combinations, and we want to give out. If we don't give out a shout out to our state partners, they get upset because they watch our Facebook lives all the time, and they go, "Hey, wait a minute, you didn't say the state." We know that the state has been a critical partner in working through us for our mental health needs. We just came out of Mental Health Awareness Month, and as you just said, Dr. Garrick, and we want to make sure to say it again, all mental health is just as important as physical health, and people have been through trauma through this thing. There's no question about it, and we got to work through all of that mental health issue as well.
They go hand in glove. You can't ignore the impact. And I don't think we can say enough good things about what the state of New York has done and the county in terms of getting us through this pandemic. They have been spectacular on the OMH side of mental health, on the Department of Health side. In fact, it was the Department of Health that helped every hospital in the state figure out the pathway to reopening, to being able to take elective surgeries back safely. we've all seen on the news that some places have, opened up, but they haven't necessarily been doing that in a thoughtful way. And certainly we all saw the same pictures of people at pool parties with hundreds of people at the pools without masks, not in New York State, but in other places. And we're sitting on pins and needles, hoping that nothing, untoward happens. But we're all saying, you don't need to behave that way. There's a much safer way of going about this and still being with your friends, but being safe. And the state and the county have certainly been phenomenal in how they've handled it. Let's be fair. Rockland County, right here, was the epicenter, the highest per capita of COVID in the country, and Westchester was right behind them.
Right.
The state of New York was inundated, and I have to tell you, as a proud New Yorker, no state could have handled it better than New York did.
Well,
we had our learning bumps, no question about that, but this state has a lot to be proud of.
Well, Dr. Garrick, can we give out the numbers, because I know we probably have them handy dandy for first the mental health line that you just talked about, and then we'll talk again about the testing site, because again, the testing, if we need to be able to get both the diagnostic for those folks that need it or antibody testing to do that. So mental health, the number
first, and we'll give you these numbers to put up on your screen, but the mental health hotline is 914-216-7733.
Okay.
And then the testing, for the antibody testing, which again, as you said, you need an appointment. That's over at the county center, and it's 914-228-4530. And it's typically open Monday to Friday to schedule an appointment, and we welcome everybody. We want people to come get tested. It's from a public health perspective. As you know, we don't yet know if those antibodies protect you forever or even protect you for a short period of time. That research is ongoing. Actually, we may be joining the Regeneron, who's doing a trial looking at how the antibodies are made and their importance, whether they actually protect us from disease, and if so, how long do they last. But right now, the real reason to do antibody testing is for some peace of mind, yourself, and the hope that they protect, but also to give us an idea of how many people have been exposed. Because remember, a lot of people had COVID and were asymptomatic, especially younger people. So it's really important as we try to get that so-called herd immunity, since no one ever had this disease, in order for us to be safe and largely immune, a certain part of the population has to develop some kind of antibody protection.
Right.
Now, antibody protection and antibody testing is very important for both ourselves, a little bit of peace of mind, and for public health to know. And you mentioned last time about the kind of antibody testing, and you're right. You've seen lately, since our last chat, that some of the antibody tests are not as reliable as others, and that's clouded the facts and worried us a lot, because bad data is not better than no data. Bad data is bad. And
right.
If we want to be misled, we want really carefully considered factual data that we can all hang our hat on and know how to predict the future.
And they want, and people want to, the other thing, Dr. Garrick, if you people ask and they say, do you know what the test that Westchester Medical Center uses? I said, talk to Dr. Garrick about this before, and she assured us is the percentage test, as you see, is an extremely high percentage, 99% or higher, right? Which is, there's nothing.
Our test has a 99% specificity and sensitivity. And what that means in English is that if you have the disease, we'll find it, and we won't find something instead of that. So you want to be specific, finding that problem, and you want it to be really sensitive, that if it's there, we got it. So you need it, especially when a disorder is not common yet in the community, when only like 5% of the population has it. You need to really have a test that's very exquisitely sensitive and specific, or you'll get a lot of what are called false positives. And that's really dangerous, because then we think someone's had it and they haven't. And that's bad, because it means you may not take protection, right? Which would be dangerous. And it may be that you get it and spread it, which is also bad. So it's really important to do it the right way.
And we're going to end on that particular note, because again, we're going to hold the mask up again and say that even if after you went through the testing, right, that the reality is that you still need to social distance, you still need to wear a mask, you still need to do all the levels of protection. Don't, there's been, stories out there, people that have taken these antibody tests that may or may not, have not been as reliable as the one that WMC is using. It's people that have gotten taken advantage of, paying for tests. The test the one that's working here is not, the antibody test is not a charge for that particular one, right? For certain scenarios, if you have insurance on certain things and certain categories, there's things, so I would not want to blanketly say that there's never a charge, because there may be, right? But the reality is that the antibody testing being done by the WMC Health, the Westchester Medical Center, is that it is 99% understanding and specific, right? And identifying.
Before we end, I want to repeat what you said. Even if you get tested, even if you have antibodies, please wear a mask, because we don't yet know everything about what they mean, and we want to help keep everyone else safe. So I know it might sound like, wearing belts and suspenders, but even if you're tested and even if you're positive, to be respectful of your other members of the community, wear a mask and give us some chance to figure out what all these antibodies mean, and then we'll feel better about it. But for now, we should keep social distancing. We should keep being respectful, good hand hygiene. And if you need the help of this hospital or any of our doctors in our outpatient facilities, we're open, we're here, it's safe. Don't be shy about getting care, because if you're sick, don't stay home. Let us help you.
And make sure that you take advantage for those folks with that have the ability to take care of the telemedicine option, right? There's no reason for someone that doesn't feel well to not take advantage of telemedicine. If they're really sick and say, I feel I need to be in the emergency room, get to that emergency room. WMC has the great screening procedures to make sure that the folks are taken care of correctly. Well, Dr. Renee Garrick, the Chief Medical Officer, thank you so much for taking time with us and giving us, again, some additional information, some additional understanding, reminding people, if you need to be at the hospital, go, to make sure that you're doing your jobs and being able to help save people's lives, and making sure that they're getting that treatment before it gets to a critical stage where the options become more limited. So it's always better to do that and take advantage of that that time in between, and get to the hospital when you need the help. So Dr. Garrick, it's always good seeing you. All the best to you. Stay safe with the mask as you go through the hospital, and making sure that all of the folks there are continuing to do the outstanding job. We want to continue to applaud you and all of your colleagues for the fine work that they do, whether they're bringing food to individuals or they're the neurosurgeons that you have there. Everyone all together at WMC Health is doing a fantastic job. Thank you so much. And we want to say again, thanks for you all watching today. And we'll see you on our next Facebook Live, 11 o'clock tomorrow.
Thanks again, Ken. Great seeing you.
Good seeing you.